Hi, everyone. Hello. I am going live and I'm going live late. Probably no one is here because I've been missing my lives for no other reason except for it's the holidays and I keep forgetting. Look, Rich and I were just putting up our tree and I said to him, "Where are you, honey?" I said to him, "Oh my God, it's Thursday. I'm supposed to be live." Honey, say hi.
Hi, guys.
Hi, Hoppin. There's our baby, Roy. I've been trying to go live. I told myself I was going to go live every Thursday in December. And here it is, the first one I almost forgot. Hey, Megan. Hey, Lucy. Hi, everybody. Hey, Steph. You guys, I'm sorry I'm late. I'm sorry I've missed a million Thursdays. Yeah, so anyway, I'm here. I'm here for at least 45 minutes to say hello and say how appreciative I am of you guys and answer as many questions as I possibly can. And yes, I do want to keep going live at 5 on Thursdays. I just feel like November and December are really, really busy months for the world, or at least for America. And then for me specifically, because Rich and I have our birthdays, and we have our anniversary, then we have Thanksgiving, Christmas. My mom was in town. Hey, everybody, come on in. Welcome, welcome. I feel like you guys are all my hardcore supporters if you're here right now. So thank you so much. Oh, first time login. Last Boy Scout. I like your name. Welcome, everybody. Can you talk about grief a little from hospice nurse view? Normal feelings, coping, crying. So I feel like from a hospice point of view, I think it depends on how well you've learned how to have boundaries and like how much you work, how well you are able to have a good work-life balance. I didn't start hospice nursing until like 8 years in my career, so it was easier for me, I feel like, to work on boundaries, know what I'm willing to do, what I'm not willing to do, versus when I first started nursing. I didn't really have those skills. So I think it's important to try to utilize those boundary skills, work-life balance skills, take time off when you need. You can't be everything for a family. You have to allow other people to help them as well. But I think it's normal to have hard days and feel sad and feel overwhelmed and feel like you can't keep doing it. And those are the times when I think you need to take some time off, whether you feel like you can or not. Everyone will tell you you can't, but you just have to. I have done that many times. Okay, welcome everybody. It seems like more people die around the holidays. Is that true? I don't know if that's actually true, but I do know what you mean. I also feel like a lot of people hold out for the holidays. They hold out for the holidays and they die right after the holiday. Just found out my friend has stage 4 lung cancer. I'm so devastated. That is devastating. It is so hard. I'm so glad you're here. Thank you for being willing to be here. We love our pup Roy too. I'm obsessed with him. Thank you, Love Thompson. Oh, I'm coloring with my phone by me. I love coloring. Welcome, everybody. Come on in. I'm just looking through the chat. Emma says, first time here, was a caregiver for my folks 8 years on our farm. Wow, lost my daddy. Then 6 weeks later, my mom was overdosed last year. Found your channel. Oh, Emma, thank you for being here. And thank you for being there for your family. Ronald, 4 deaths in a year and a half, stage 4 pancreatic cancer diagnosis. It's overwhelmingly sad. Yes. I think when it comes to grief, I just did a video about this. If you go on my Instagram, you'll see my latest reel. It's about grief and hospice and how it's complicated. There's different levels of it. There's different reasons for it. And it doesn't necessarily have to be because your loved ones has died. A lot of people will grieve and feel all types of ways even before their loved one dies. Even just being a caregiver, you can be exhausted, you can be tired, you can wonder, when is this going to be over? Why is this taking so long? And then you feel guilty that you're thinking that or even saying that. but it's all really, really normal. And we need to talk about it more. When is the Czech version of your book coming out, please? That's a great question, Sonia. I have no idea. I can ask my publisher. Those things take a while. So I know they bought the rights, and then it may take, 6 months, sometimes a year to even get it out. But I can try to look into it for you guys. Yeah. So it's going to be published in Arabic, Czech, Polish, and Spanish. Oh, thank you, Amy. Love your channel. Just getting ready for a career in hospice. I lost my husband to glioblastoma and brother to multiple myeloma 5 months later. Jersey, oh my gosh, how are you getting involved in it? And thank you so much for caring for your husband and your brother. It's just so, so hard. Thank you, Emma. Yeah, Emma says she's so thankful. What I would say is anyone here who feels, overwhelmed or alone, this is a really good place to come. And that's why I really want to hard to be here every Thursday, because I do think it brings, a core group of people together. People talk in the chat. It's not just me talking. You guys can talk amongst yourself and support each other. So I think it's really important we try to start a community. Just waiting on my license. Oh, it's amazing, Jersey. My father saw black things coming for him. He was completely lucid, asked me to pray. He was not someone who wanted to hear it before. Interesting, Emma. Yeah, I've never had that happen to me, but I can't say it doesn't happen. Why do people who are actively dying pull their hand or arm away when touching them? Is it bothering them? I think it depends on the person. I think generally speaking, if the person was someone who wasn't super touchy-feely, they probably won't want to be super touchy-feely, even in death. Just depends on the person. I would say, as hard as it is, don't take it personal and allow them to be the guide. You can always try again later. Maybe they'll be into it later. Maybe not. It just depends. So I wouldn't say it's typical. I think everyone has their own, sensations and what they want and don't want. Sherry says, trying to get through the first holidays without my son. He died of cancer. I was his caregiver. Miss him so much. It's so, so hard. Thank you for being here, Sherry. Let me know what you think about this, Sherry, and everybody else. Tell me what you think about this. So I was thinking about what to do during the holidays when you're grieving. Like, people always want to know what you should do. And honestly, I'm not an expert in that, so I don't really know, but I was thinking about something that I think I might like. So whether it's the first holiday without your loved one, or it's like your last holiday with your loved one, if you know they're not going to make it to another Christmas, right? I think there's something about starting a new tradition. So if they're still alive and it's going to be their last Christmas or last holiday season, starting something new to create new memories with them, right? Playing a specific game, or baking a certain type of cookie, or just having friends over and having a little party. And then from years after that, after they are gone, continuing that new tradition, but in memory of them and thinking back to the last time you guys were together. Or if they are already gone and it's your first holiday season without them, starting a new tradition, which I could see how that could hurt because it's a new tradition without them, but it's a new tradition in memory of them. So it's a time for everyone that loved them to get together and do something in honor of them. Making a new type of cookie all together. And then every year after that, it's like the Brandon Christmas party or whatever their name is, right? Where you're doing it in honor of them. You're making the cookies in memory of them. And it continues on for generations and years after that in memory of them. And then you're making beautiful memories and keeping their memory alive. I was thinking about doing a video about that, but I wanted to hear what you guys thought. As grievers or someone who's going through this, is this something that does sound good to you, or is it a little too much? I genuinely want to know. So if it's like, no, that'd be too hard, then that's okay too. Just curious. Welcome everybody. Thanks for bearing with me and being patient with me. Wasn't on for the past couple weeks, and then I forgot today. Nothing to do with you guys. It's all me. Just being busy and forgetting that it's Thursday at 5. How can one ensure they can be taken to hospice from an aged care home if no one has relatives? Well, usually the hospice would happen in the aged care home. So it would usually happen there. Depends on where you're at. If you're in America, hospice would come to you in the aged care home. Now, if you're in the UK or something and there's like a hospice to go to, you could try to get that. I would try to find someone you trust, even if you don't have family or a friend or someone that you trust, to make them your power of attorney, healthcare power of attorney, so they can make those decisions for you if you can't. Please take your time with grief. It's okay to do nothing. Yes, Jersey. It is okay to do nothing. You don't have to do any. Yes, exactly. You don't have to do anything. Paint with PA says, hello, I'm 74 in fair health. I have my funeral arrangements bought and paid for. It's important to get it done. That is very true. Thank you, Sherry. Welcome, everybody. Welcome, everyone. Come on in. How was everyone's Thanksgiving? What attracted you to hospice nursing? I was an ICU nurse for many years, and that attracted me to be a hospice nurse. After seeing people die in the hospital and seeing us trying to keep people alive at all cost, I saw how much that caused people to suffer. And I thought, if we're all going to die, which we all are, there has to be a better way, and I want to be a part of that. So that's how that happened. Yeah. I tucked her in the funeral home, let me close and lock the casket. Oh, Ronald. I have a weird obsession with death since my twin died soon after our birth. Is that normal? I know people are freaked out by it. I think it's normal. I mean, I've had a weird obsession with death and the afterlife and what life is all about, kind of like existential. Like I've always been pretty existential, even as a little girl. So I don't know. You're probably talking to the right people over here. I've always been into it too. Are you already ready for Christmas, Julie? I am not, but I was getting ready for Christmas, as you see, opposite over here, as you see over here. And then Rich and I both remembered that I was supposed to be on live. So we stopped real quick and I went live for a little bit, and then we'll go back to Christmas decorating. You ordered my book today, Cole. Thank you. Have you heard of any NDAs? You mean NDEs? I have heard of many near-death experiences, but none of my patients have had that. All my patients die and don't come back, which I think is okay. That's the usual. That's the fitting. That's the fitting thing that happens in hospice, and we have to. It's hard, but I think my whole point of being here and educating is to help decrease that fear a little bit. But NDEs, near-death experiences, certainly help people not have fear. And I'm thinking about having people on, maybe starting some kind of podcast or episode every month where I talk to someone who talks about a near-death experience or their experience with death and dying. I think it could be interesting. I was a midwife for many years. There are a lot of similarities between birth and death. And that is for sure. I always talk about how watching someone take their last breath feels like watching someone give birth. Like watching the baby be first born, that feeling I get when I see a baby like fresh out of a mother, which is insane to say, the fact that even happens. is the same feeling I get when I see someone take their last breath. Feels very, I can't think of a better word, but like magical. I think because the grief for me is removed. It's not my mother I'm losing, right? At least not yet. So I'm able to kind of see it for what it is, which I think is it's like a miracle. Although I know it doesn't feel like that when you're the one losing your loved one. Aggressive, not sleeping in the last stage. Any suggestions? Debbie, if they are on hospice, push, 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 push. Keep calling them, push for them to medicate more. I mean, really, they need to be more aggressive with medication. It sounds like that your loved one might have terminal agitation or something. Of course, they would know better than I would. I'm not there, but generally speaking, if someone's being aggressive, if someone's not sleeping, we need to be a little more aggressive with medication, or check to see if they have a UTI or something. Maybe that's why they're being more aggressive. Who knows? Like kind of try to figure out why they're being aggressive. If you can't really figure it out, because sometimes it is unknown, then I would go to trying to medicate to get them to back on a regular sleep schedule to maybe start backing off. But sometimes just due to disease process and people's personalities, sometimes you do just have to heavily medicate, unfortunately, because you want them to be comfortable and you want them to be safe. So it's a risk versus benefit type thing. Welcome, everybody. Don't forget to, so on the bottom right corner, I believe, is like a heart. If you hit that, that helps my live. If you don't already follow me, I'm Hospice Nurse Julie. I'm a hospice nurse that educates about death and dying. I have a New York Times bestselling book, thanks to you guys, called Nothing to Fear. And if you haven't gotten it already, and you're curious about what I'm talking about, most of your questions, I bet, could be answered in there. You have a chapter, oh, here you go. Meredith says, you have a chapter in your book that is to the dying person. I need my dad to listen to this. Will you do a YouTube video specifically to the dying person around this chapter of your book? Meredith, let's slow clap for Meredith over here. I hope you're still here, Meredith, because that is a brilliant idea. And I may have done something probably like that-ish, but not completely. So I'm shooting my next YouTube videos this Sunday. So I will. And then it'll come out in January. So if you're not subscribed to my channel yet, you can subscribe to my channel. It's free. You can even get notifications, so you can be notified when a video comes out. They are usually published every Wednesday and Sunday. That's a great idea. And I can do that. Yes, I can do that. I'm an inpatient phlebotomist, and I get to know people pretty well, seeing them daily. Then they die. I get extremely sad and sometimes cry. Yes, that would be, I feel like I was, it's funny. When I worked in the hospital as an ICU nurse, I was much more affected by people's deaths than I am now. And it's not because I'm callous. It's not because like, oh, I don't care now or it doesn't affect me. I think it's because I've gotten to a place because witnessing hospice deaths, it's like for the most part, it's like taking a bad situation, a sad situation, and seeing that we can make it as beautiful as possible. Like to me, being in the hospital and like fighting and then dying feels like so much harder and so much more tragic than the acceptance around death and being at home and like living out the rest of your life until you die. There's something about that feels beautiful. So it doesn't feel as sad to me anyway. Scorpion Heart says, hope you're still here. My brother had a heart attack and had to start dialysis. Can you suggest appropriate approach to ask the doctor and his wife, how long does he have to live? He's stage 5 without sounding cold. He's home just going dialysis 3 days a week, but it's not looking very good. And I've been listening to your videos. Okay, so I don't know your relationship to your brother. Okay, so you have to weed that out, right? I don't know how close you are. I don't know like if you've been really involved and it's like appropriate, right? So if you're super close to his wife and him, um I would I would just ask. I would say, has anyone talked about, you could always say, I always say, make it like, you can turn it into something helpful, right? Like, I want to be helpful to you. You can say this to your brother or to the wife. And if you're not close to them, this is going to be a little harder. Okay. But if you are, you can say, I want to be helpful to you. I know you seem to be doing okay right now, but if something were to happen, I think it's important that we know what you'd want, like I think it's important we'd know, like, what would you want if you started to decline, or what would you want us to do if you stopped being able to tolerate dialysis? How so you could just you word it like I'm doing this because I care and I want to help, which is true. So that's a good way to bring it up. Also, again, if you're like close with them, you could always it's hard because you're not going to be around his doctors really, but if you are, you can always just ask. Um, and I don't know, if your brother's alert and oriented, I would talk to your brother. It's really hard to know. I mean, people can live a long time with dialysis. I don't know how sick he is. Again, it's like really hard. I'm generally speaking here because, oh, very close to his wife, very close, but wife prefers I'm not too much in her business. Okay. He accepts all the help, but his wife doesn't. Yeah. You got to meet people where they're at, girl. If he's alert and oriented, I would talk to him. Maybe around his wife. I don't know. Or you could say to him, like, hey, what if we had a family meeting so we all could get on the same page so we can best care for you, you know, uh, as things approach, right? It doesn't mean that you think anything's going to happen, but you're just trying to make sure that, like, you're just trying to help his wife, help him. But it's tough. This is what I always say too, is like, you can do the best you can, and sometimes it's messy because not everyone wants to talk about it. Doesn't mean you're doing anything wrong just because it gets messy. Um, I hope that helps a little bit. What do you say to someone has terminal cancer when you see them? I think you just talk to them. It depends, again, Brenda, it depends on how I always felt stupid saying, "How are you feeling today?" Oh, Brenda, no, it's okay. I think it depends again on your relationship with them. If you're super close, you can always just say, "I don't know what to say." I want to say everything right. I don't want to say anything wrong, but I just want you to know that, like, I love you and I want to support you however you feel supported. And you can just be, yeah, I don't think there's anything wrong with, like, how are you feeling today? Is there anything I can get for you? And be yourself. Be yourself. Say the truth. And I think we really try to avoid just really uncomfortable, right? So we try to avoid it, or we don't know what to say. And I think they want to just be treated like everybody else. And, I've always found, because I'm in a position where it's not weird that I start talking about death and dying because I'm the hospice nurse, I find that most people seem grateful that someone's finally willing to talk about it. Now, you're not really in that position. I get it, because you're like not the hospice nurse. You're just their friend, not just, but you're their friend. So you can, depending, if you're really close, you can say, hey, if you don't have anyone to talk to about this stuff, you can always talk to me. You don't have to. I can just be your friend and we can play cards and watch TV together and laugh and just do whatever. And that's fine too. Or if you need someone to talk to, I'm willing to listen. Like, I'm comfortable with whatever you want, and see what they say. How do you deal with religious conflict and conversation about death when your patients practice a faith that contradicts yours? Oh, I would just go with whatever they say with their faith. I would never, ever go, well, that's not what I believe. And if you don't believe in Jesus, you're going to hell, which I don't believe that. But yeah, so really, I think that's an ethical thing in healthcare. I mean, ethically, I would never be able to Um, I just would listen. I'd be so happy in whatever faith they had and believed in, even if that faith was making them make poor healthcare choices. Like, I just did a video about a woman who it wasn't really because of her faith, but she had like a belief in only Eastern medicine and not Western medicine. So she refused to take any like steroids or morphine or anything to help with her symptoms. So she had a really symptomatic death because the Eastern medicine she was using was not working. But all I did was respect her autonomy and respect what she wanted and give my suggestion if she wanted it, but also respect where she came from. So I would do the same thing with religious beliefs. And I would encourage people to rest on their faith, if that whatever faith it was. So if it contradicts mine, that's no problem. And I would never even say that. I would never say, oh, well, I don't believe that. And if any healthcare workers are doing that, you're wrong. Any healthcare person on here is preaching, or I wish Rich was here, proselytizing. I've been saying it wrong. That's wrong and unethical, and you cannot do that. Okay. Rich, are you in here?
No, I'm in here.
Can you hear me say that? Proselytizing? Did I say it right?
Yeah.
Okay. I am just reading through these questions. Hello, everybody. If I missed your questions, please rewrite it in all caps. Hi, Janet. I put Christmas lights on my cart early so people will be able to enjoy that. Oh my gosh, I love it. Jersey, I'm glad you're here again. I know you were talking about that. Can you talk about end-stage renal disease and toxins, Tamara? So dying from end-stage renal disease, generally speaking, so this is just generally speaking, not everybody, but most people die quickly. So it's a quick end of life, but it's usually a very peaceful end of life. So as long as they haven't been in and out of the hospital a million times, if it's just like they've been on dialysis and then they decide to stop doing dialysis, they usually will die within 7 to 10 days. In those 7 to 10 days, there will be toxins that build up, but most of those toxins, for the most part, will be the main symptom they'll have because of those toxins will be itching and confusion. So the main to me, it's one of the more peaceful deaths. They usually just fall asleep until they die. So no eating and drinking, just because they'll be sleeping all the time. Sleeping all the time, not eating and drinking. Sleeping all the time, not eating and drinking. And it's usually pretty painless. And like I said, the main symptom would be confusion and or itching. But other than that, it's because of the bilirubin. Yeah. Other than that, it's pretty peaceful. But it is quick, usually 7 to 10 days. Megan, thank you. I have this really itchy foot. Welcome, everybody. Thanks for talking to each other in the chat. I think it's really important. I'm glad you guys do it. Kayak Dread Girl, is there any way you can rewrite it in all caps so I can see it? It'll be really hard for me to try to find it again, unless you just wrote it. Do you stay with people who are dying alone? It's scary to hear some people die alone with no family. We don't always. A lot of times if they're alone, they're going to be in a nursing home anyway. So a lot of times people in a nursing home will stay with them. However, I will say some people choose to die alone. Some people will wait till everyone leaves until you die alone. So I don't know. I know people think it's scary, and maybe some people do feel scared, but I've seen many people wait until everyone leaves so they can die. When should people stop chasing clinical trials? It's way too dependent on so many things. People's age, people's diagnosis, what they want, right? I think people take it too far most of the time because of how our medical system is and how we don't ever talk about death and dying. And especially oncologists and people in clinical trials will not do that. Now, I don't think they're necessarily doing anything wrong. I think they're doing what they've been taught. But generally speaking, I think most people take it too far. But it's too hard. It's really a case by case basis. I think generally speaking, what we need to start doing is really start talking about death and dying before we're dying. All of us. That's why all of us here are doing a great job. We need to change the way we look at death and dying and view death and dying. I think that would start helping us not get to this place where we're doing clinical trials on people who shouldn't be doing clinical trials. If anything, if that's you in the chat right now, I would say have a really honest conversation about with your oncologist or whoever you're working with for your clinical trial. Try to talk to them very seriously about what it means. What is it really going to help? How? And that's the thing with clinical trials; you don't really know. End-stage pulmonary fibrosis is hard for me to talk about because I don't actually see many people on hospice with pulmonary fibrosis. I do every once in a while. The main symptom, of course, is shortness of breath and coughing. We can keep people comfortable, but we have to really, really medicate them. Generally speaking, for some reason, I feel like they die in the hospital more. I don't know why. What do you think about getting divorced for insurance when you're dying? Spent 54 days in the hospital, now need transplant and lots of procedures, Medicare not enough. Sherry, I'm so sorry. I have no idea. Getting a divorce for insurance? I don't understand what that even means. Getting a divorce. You usually get married for insurance. I'm not sure, Sherry. I'm so sorry. Okay, Kayak Dread Girl. My husband was diagnosed with stage 4 secondary cancer 3 years ago, and it's now shrunk. I was facing him dying. You helped me so much. What are your experience with stage 4 patients who I do see some patients using medical aid and dying. Yes. I live in California, so I do see that. Kayak, I'm waiting for your second part of your question. Should you wake up a person in a deep sleep to feed them, but they haven't really eaten much lately? If they're on hospice, I would say no. Would a person with MS qualify for hospice? Yes, but it has to be very, 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 very end stage. So it's tough because you have to be, you could try, but there's definitely a lot of criteria. You probably have to have some kind of infection. You have to be, I don't know the exact criteria, but you have to be very, very, very debilitated. What I think happens when we die, this is just my belief. I believe we go to a place that feels more like home than here ever could. So the idea of it being scary is not scary because the second we're there, it's like we've always been there. How did we ever forget this place? This is where we belong, is what I think it feels like. I'm just looking through. Hi, Sadie. Just looking through the questions here. Give me 1 second. What's the longest time frame you've seen someone on hospice? Definitely a couple years. I mean, Medicare's cracking down on that. So we really have, if someone's going to be on hospice for a couple years, we really have to prove every 2 months that they are still appropriate for hospice. So it's tough, but people can be on for quite some time. I'm not far enough north for the earthquake, thank God. Yikes. Yikes. Kayak, I didn't see the rest of your question. I'm so sorry. I saw what you wrote, but then I didn't see the rest of your question. Shoot. Oh, good, Ursula. That makes me so happy. Okay, here it is. His cancer has shrunk. The hospital has called him a miracle. What am I to expect? So, you're not going to like this, but who knows, right? Because it's already a miracle that the cancer shrunk. So he's already doing probably what most people don't do if it's a miracle. I think in these situations, this is what I think, really easy for me to say, right? But generally speaking, kayak dread girl, which I love your name, I think we really like to have answers and like live in the black and white. And I'm not like criticizing you. I'm saying that's what I like. I love living in the black and white, knowing exactly what to expect. I think generally speaking, when something's kind of out of the ordinary, which it sounds like his is, he was given 11 months with treatment for 6 months. It's been 3 years. I mean, he's already kind of the outlier. So obviously listen to the doctor, listen to what the doctor is saying, follow what the doctor says. And I think it's like you've been given this gift to fully understand that, like, what it means to be like dying and then not die. Right. So I think getting comfortable with trying to live in the gray area versus like the black and white of like knowing exactly what to do and exactly what's going to come. I think trying to get comfortable with living in the gray, not really knowing, but knowing that life is precious and time is precious, and to try to live every day you can. And if he is clean and safe and comfortable, let him do what he wants, you know? Oh, kayak girl. Yikes. I do not know anything about CBD oil or colloidal silver, except for that it turns your skin blue. Please, dear God, no. No. No, girl. I am not your girl for that. I am not condoning that. I'm not condoning that. Did you guys watch my video on Mother God? Please, dear God. Kayak tread girl. Can't say any more of that. Listen to medical doctors. That's what I think. Listen to medical doctors. But I'm very happy he's doing better. But yes, listen to medical doctors. Medical doctors. Have you cared for anyone with pulmonary fibrosis? Was there a lot of suffering? I have cared for people with pulmonary fibrosis, not a ton, but when I was in the NICU, I took care of people with pulmonary fibrosis. For some reason, many people with that disease don't come on to hospice. I don't know why they don't. I don't know if they just are used to being in the hospital or what happens there, but we can definitely manage their symptoms, but they do have to be pretty heavily sedated because the feeling of not being able to breathe and coughing all the time can be really hard. So yes, I have cared for people like that. We can manage their symptoms, but they do usually have to be pretty sedated. Curious why you shouldn't wake them up from a deep sleep to feed them and get medicine during hospice care. Because, Lena, I would usually say let their body be the guide. And if they're sleeping, their body wants to be sleeping. Allowing the natural dying process to take over is okay. You're not starving them to death or anything like that. Their body wants to sleep. Their body knows it's towards the end of life. So when your body knows that, it makes you start sleeping a lot and makes you not eat and drink that much. So I wouldn't personally wake someone up out of a deep sleep to feed them. One, it'll likely eventually cause aspiration pneumonia because they're not really fully awake and someone's trying to make them eat. So that's why. Now it's up to you and whatever you want to do. But personally speaking, I go by, are they clean? Are they safe? Are they comfortable? So if you keep them clean and you're keeping them safe and they look really comfortable and they want to sleep, let them sleep. If they sleep 22 hours a day and don't eat and drink, that is their body's way of naturally shutting down. That's what I think. That's what I think. But not everyone thinks that. I think that's what I would do if it was my loved one. But yeah, you still can always do that. But I think you need to be careful. If you're going to wake them up, make sure they're really awake. Make sure you put them up and they're fully awake before you start feeding them. Best way to support someone dying is depending on their disease, but generally speaking, this is, are they clean? Are they safe? Are they comfortable? Are they clean? Are they safe? Are they comfortable? So help them be those things, help them be safe, meaning if they need cared for, help them get care. If they're not comfortable, help them get comfortable. If they're not clean, help them get clean. And if you just want to be supportive emotionally, I'd say show up for them and their family. Just show up, show up, show up. Welcome, everybody. Oh, thank you, Georgette. I like your name. Welcome, everyone. Which is the best palliative care sedation drug? It depends. If you're palliatively sedating, it depends. It really does depend. I can't really, if you're truly palliatively sedating, I would say Versed and some kind of pain med, but everyone's different. Jana, I would say it's called medical aid in dying, not assisted death, and I don't think it's wrong, no. Welcome, everybody. Okay, so listen, we did it. I got on a little late, but I was live at 5 finally this Thursday. But for all you guys who are new, I'm going to try to be live at 5 Pacific Standard Time every Thursday. Now, it is the holidays. And I think next Thursday I'm going to be away. I'll keep you posted in the community. I'll let you guys know. There's a little community tab. So if you're not there already, subscribe to my channel. It's free. Hospice Nurse Julie. And I try to do lives at 5s. Now, for sure in the new year, I'll be much better at this. It's just crazy when it's like AK live at 7 for Central Time. Yeah, exactly. It's just crazy over the holidays. But subscribe to my channel. It's free. Hospice Nurse Julie. You can get notifications when I'm live, so it'll notify you. I post new videos mostly every Wednesday and Sunday. And it's a great community here. A lot of the same people come back every week, so it's great. You guys support each other in the chat. Love you guys for doing that. I have a new book out. Well, it's not new. It's from June, which you guys made a New York Times bestseller because you guys bought it. Thank you. It's called Nothing to Fear. Thank you, Hoppin. It's called Nothing to Fear. Let's see if I have it. Hold on. Here it is. Nothing to Fear by Julie McFadden. So if you want more of your questions to be answered, they can be found in here. And I love you guys. Thank you for the $4.99. That's so nice. Rich and I are going to get back to decorating for the holidays. And thanks so much for everyone who's joining me and all my regulars. You guys are the best. Mwah, mwah. All right. Thanks, guys. Bye.